Thanks, Kevin, for the title inflation. I'd like to be the head of the Center for External Innovation, but I'm not. I have a boss. You'll take care of him, right? But I am responsible for, I am the head of the Strategic Alliance group within the CEI. And the CEI is basically the licensing, investing, and transactions group for the R&D organization for Takeda. So a few opening remarks before I start describing a few things at the TDI and how that might be applied here. But first of all, for those of you faculty and students who take advantage of Spark, you have no idea how lucky you are. You live in a community and you see the availability of Spark, and it's easy to take it for granted. But as somebody who comes from industry, somebody who goes to a lot of academic centers all over the planet, there is nothing like Spark. There really is not. There are a lot of different mechanisms that allow investment in academic research to translate some of the work that's going on in the laboratories to move things toward therapeutics. But there's nothing as productive, as engaged, as innovative as Spark. You have a community here, not only of academicians, but a congregation of people who are truly interested in this field from other institutions, from other companies, from venture capital, and it's a resource that is the envy of the rest of the academic community. It really is an amazing achievement. I know that Daria and Kevin are trying to expand to other places, and boy, are they lucky to be able to get this if they can replicate it, because as Ben said, it's very difficult to replicate this kind of a culture elsewhere. But understand that you have a resource here at Stanford through Spark that nobody else has. Take advantage. Take advantage. So I wanted to talk a little bit about some of the things that Andrew Lau had mentioned and that Dean Miner had also mentioned. And this has to do with the economics, and I apologize for all of the noise. I've just gotten over the flu. It has to do with the economics of how drugs are being developed today versus the way they were about 15 years ago. There is a valley of death. And it's exacerbated by a couple of other moves that are happening. One is that there is a greater demand for precision medicine, and there are tools to be able to identify patients who will respond to drugs. What that does is it narrows the classes of therapeutic areas to those patients who will respond, and now there's a demand by both patients and by payers and by governments and hospitals to be able to identify those groups that will respond. What that means is the days of the large blockbuster drugs is coming to an end. We are going to be dividing large therapeutic classes into narrow groups that are going to be treated by individual drugs. Cancer is not cancer. Cancer is hundreds of different diseases. Senility is not senility, it's frontotemporal dementia, it is familial Alzheimer's disease, and many other different kinds of Alzheimer's that are now being discovered through, again, these tools of precision medicine. The demand that's being placed on the pharmaceutical industry, therefore, is to come up with novel therapeutics that can treat those patients. The dirty little secret of the pharmaceutical industry is that without the precision medicine, lots of medicines were being prescribed to patients who did not benefit from that drug because we couldn't identify who could benefit from those drugs. Now we can. So that means that there's going to have to be a huge diversity of biology, of mechanisms, of targets, of therapeutic modalities, of different combinations of drugs to be able to treat these patients. For a pharmaceutical company, we need more and more and more innovative targets. That creates a very risky environment for us to conduct research. These things that are not published in Nature but coming out of your laboratories are the things that we want to get after. Another dirty little secret of the pharmaceutical industry is that because of some of the things that Dr. Lowe was talking about, validation of targets and looking for things downstream, The pharmaceutical industry is working on the same 20 targets. We're all working on the same targets, and we cannot continue to do that. How do you fix this? You go to academia, because this is where the discovery biology is taking place. This is what Spark is actually nurturing, is fertilizing, is creating these opportunities for me. So, Ben, to answer your question, why am I here? I'm really selfish. I really want your targets. But I don't want to take them away from you. I want to help you make them therapies for patients. The number one principle of operation for Takeda is the patient. How do we get to the patient? How do we treat the patient? How do we make meaningful changes in the lives of those patients? And if you were to ask the Stanford Medical School's number one principle, it's the patient as well. We are aligned. We should be working together. We are not on opposite sides of a chasm. There shouldn't be that chasm. It exists. Believe me, it's real. But there are ways to get around it. And my job is to try to figure out a way to do that. So I'm hoping I can show you a few models that we're doing in New York, elsewhere, might even bring here, and maybe expand on some of the things that you guys are doing with Spark. I'd love to be able to do that. Let's see if we can just make this happen. So let's get on with this presentation really quickly. Many of you don't know who Takeda is. We're a 235-year-old company from Japan. Wow. I felt old until I saw that. We're also the largest Japanese pharmaceutical company, but we're also present across the world. We have 30,000 employees. We have research sites in Japan, San Diego, Cambridge, Massachusetts, Cambridge, UK, Singapore. We're located all over the world, and we have a revenue of about $18 billion, but that's not really that interesting. There's a couple of interesting things that we did come up with. We do have a new product called Entyvio, which is a breakthrough therapy for people with Crohn's disease. It's an antibody therapeutic. We also have a new drug called Ninlaro, which is a proteasome inhibitor for people with myeloma and other leukemias that is being introduced, and both of those are saving lives and allowing patients to get out and have normal lives, and that's our goal. If we can make that happen, we'll make money, and the money part will come. But let's get to the patients. So I'll get through some of this quickly, but wanted to tell you about some of the things that Takeda is doing. Even though we're 235 years old, sometimes I feel like it's 235 million years old, because we're so staid in the way we think. That's changing. It's changing dramatically. We have a new set of management who's focusing on external innovation and finding ways to engage this. It's a breath of fresh air, and it's really terrific. I'll give you a couple of examples of things that we are doing that in thinking differently how we might engage early stage innovation coming out of academia. First is an incubator in Israel that we co-invested alongside Johnson & Johnson, Orbimed, which is maybe the largest, I don't know if it's the largest, it's one of the top 3 largest biotech venture capital firms on the planet, and leveraged investment by the Office of the Chief Scientist in Israel to start an incubator where we invite people to bring their innovative programs, and we wrap companies around them. We put in the management, we put in the systems, we have shared resources for legal and HR and all those crazy things that you scientists really shouldn't be bothered with. And importantly, we wrap financing around it. And we can move these programs forward. That's one example. Second example is one here in the United States. There's the Harrington Discovery Institute that is a chronic, I like to say it this way, a chronic investor in innovation coming out of academia. They have funded some really fabulous work and came up with a problem that once their funding went through an animal proof of concept, what do you do with this thing? They also set up an incubator, invited some companies, Takeda's one of them, there's another that I can't name, unfortunately, who's an investor in this, plus other investors to, again, set up an incubator that can wrap companies around these individual assets and provide the shared services that allow projects to move but don't distract the founders from the science. But I was interested in looking even earlier. And so I'll talk a little bit about some of the work that we're doing in New York. We have an alliance with 3 institutions, and this was already described a little bit by Kevin, Sloan Kettering, Weill Cornell Medicine, and the Rockefeller University, who together put together a drug discovery institute between the 3 of them, which is a not-for-profit drug discovery institute. And we are the exclusive industrial partner to this enterprise. The idea here is that these academicians are extremely productive, like Stanford. It's actually analogous in many ways to the productivity of Stanford. Great innovation coming out, didn't know how to convert this discovery biology into some chemical matter that you could test the biology. But that's what we do. We do that really well. If you give us the biology, we can come up with the chemistry. We can come up with the antibody. We can come up with the siRNA. We can come up with the chemical matter that you require, right? They couldn't do that. What we couldn't do is come up with the biology. Our discovery research group is about 10% of the faculty in that community, actually less than 10% of the faculty in this community. We have less than 1/10 the brain power of that group, and they're way smarter than we are. So is there a way that we can combine the 2 together and produce something new so that we could employ our expertise to advance their programs and together move programs forward closer to therapeutic development for patients? And this is the result. We now have this not-for-profit institute. Biology is sourced from the universities. We have committed 15 medicinal chemists that we shipped from Japan and now live in New York and occupy laboratory space at the Weill Cornell Medical School in the Belfer Building, 16th floor. It's actually these windows right here. Okay. We have 20 fume hoods, and it's focused on processing between 6 and 8 programs at any one time. The biology comes out, we provide the medicinal chemistry. We also provide a certain number of resource that is scattered throughout Takeda for skill sets that the universities don't have. DMPK, formulations, toxicology, pharmacology, these kinds of things. Can we provide that kind of advice? Can we take their programs into Takeda, run the experiment, and give back the results? Here's the unique part. There is a requirement for novelty of entry into the TDI. In other words, the programs cannot be things that we're working on and can't be overly published. So if Takeda were not working with these institutions, we would not be working on those targets. So to respect the origin of that biology, the chemical matter that we derive in our programs, the intellectual property for those new chemical compositions, are assigned back to the university that originated the biology. We don't own it. So what this does is the investigators own their programs. They own their programs all the way through the TDI. We ask for something in return, so that if we're working together and the program is ongoing, we'd like to have exclusivity to the data. In other words, Cornell, please don't shop the work that we're doing for you now to Pfizer. That's kind of obvious, but we ask that as a favor. We also ask for a certain time-limited period of time after that, it's a couple months, to make a decision as to whether we want to enter into a negotiation and enter into a negotiation. But the universities are not required to license it to us. If we can't come to terms after that limited period of time, they can go to Pfizer, okay? But hopefully our relationship is close enough that we can get the license done. By the way, think about this. We've done real-time diligence because we did the chemistry. We know the quality of the output because we did the chemistry. We know how effective it is because we did the chemistry, right? And so if we can't act quickly, shame on us, right? So it's a new way of establishing that relationship. It had a great side effect. The side effect is that it allowed the institutions to go to charitable investors and say, hey, would you like to invest in this? Two guys, a fellow named Lou Sanders and David Milstein, cut checks of $20 million and funded the institute. Takeda doesn't pay for anything. We pay for the people that we put in. Yeah, okay, we have some overhead cost on the occupation of the laboratory that we have there, but we don't pay for anything. Charity and the universities pay for their part, we pay for our part, and now we have an even relationship. And the output is chemical matter that you can use to interrogate the biology. You validate the biology, the discovery biology that they all have been researching. I'll tell you a story. There was one investigator who'd been working on a particular target for 12 years, and had been working on 2 molecules that she was able to buy from Sigma, and they were crap. I mean, the quality of this stuff, we took a look at it, and it was so impure. It only had about 40% of the target molecule that she wanted to purchase. And she was getting all kinds of crazy results. We entered her into the project. 2.5 weeks later, she had 75 molecules, all new synthesis, all new chemical matter, 99.5% pure, in quantities that she could test in animals in 2.5 weeks. And she actually started to cry because she said, I don't have a postdoc that can do all the work, which was kind of a problem, but we solved that. But the idea here is there a way that we can productively move things from discovery to at least an animal validation? And I think that we've done it here. To give you an idea of how productive this is, we have 15 medicinal chemists. We have commitment of equivalent monies into resource for antibody discovery that we spend each year. We have about 50 programs being prosecuted now in that. That's more than the numbers of chemical matter being prosecuted, or targets being prosecuted within Takeda at more than 10x that investment of discovery. It is way more efficient than we could ever do it in-house. And here's the problem. And the problem is programs are starting to graduate. I have to sell these programs internally. And just as Ben had said, you know, we've got a problem. Animals are not easily translated. We want later stage stuff. We want human validation. Can you move it to the next step? What do you do with that? This mechanism didn't do it. So I can't tell you a lot of the detail now, but wait until next month. There's going to be an announcement coming out about a mechanism that I'll describe to you sort of at a high-line level here. And you'll see that in this process of developing a program from the institutions into a pharmaceutical company, we have covered the first part, which is the TDI, coming up with the chemical matter against the biology. Is there a way that we can create a mechanism that we can take the graduates from the TDI and push them into clinical development? Now, that's an expensive proposition. It's a real expensive proposition because each of these compounds, remember, these are new targets and new chemical matter. Unlike the repurposing that gets done here, we have a lot of work to do to prep these things for INDs and clinical testing. It's about $20 to $30 million probably per program, and we're thinking we'll do 10 to 20 programs. You do the math, it's a lot of money. We don't have it all. We found some venture capital partners who would be very interested in investing in that kind of an engine. And so we're working together with them on a program that would create this enterprise in the middle, which is bridging that valley of death, taking programs from early discovery and putting them into human validation that then becomes attractive to a pharmaceutical company. By the way, that human proof of concept is probably the largest delta in value generation in drug discovery that there is. So let's get to the end of that point, okay? What's unique about this is that this enterprise will be co-owned by the institutions. And so that as programs are put into this mechanisms, companies wrapped around them, investment made, infrastructure built, programs eventually sold to pharmaceutical companies, hopefully ourselves, but it doesn't have to be. Money is to be made, and the universities and the professors who originated these programs are co-owners of these programs and get the benefit of that sale. So everybody wins. The investigators have a stake in their programs all the way through to an exit. And unlike the typical model of raise money, get to an IND, raise money, get to a phase 2, raise money, get to a phase 2B, and there's a serial dilution of ownership of the founders of the company. In this case, one-time fundraise, no dilution. So there's a great piece of equity that the universities and the investigators own. And so that's what it is. And it's an experiment. I don't know if it's going to work. But it's really, really exciting. And we'll see if it will work. I think that it will. We have managed to, I think, align the incentives of venture capital and academia. Not so easy. We have 8 teams of lawyers working on 9 agreements. And it's been a bit of a slog over the last year. But in the next few weeks, I think we're going to announce the launch of this thing. By the way, one of the architects was Mark Tessier-Levine, who is now your president, who called me the other day. So we would love to be able to replicate this. My boss, Andy Plump, says, how can you replicate this? Do it over and over again. Have much of Takeda's research and development externalized. We're trying to do it, and we're looking at institutions, and I'm hoping that we'll find customers for this model, not just on the West Coast, not just on the East Coast, but on the West Coast as well. So, thank you. By the way, credit to Spark, because Spark drove me to think about new ways of doing business and inspired a fair bit of this TDI model in the first place. So thank you, Daria. Thank you, Kevin. Yeah, I'll take questions.
A question. So you know that we have quite a few Spark programs that are starting in Japan. Any plans for TDI in Japan?
Yes. Japan cannot work the same way we did in New York, just because of the structures and the culture there are different. So there are aspects that we are going to hopefully develop and push entrepreneurship in Japan like it's never been pushed before, but it has to be done differently than what we're doing in New York in some aspect. What's that? Yes.
Questions?
Yes.
Two questions, please. Does Takeda have the right of first offer or the right of first refusal?
Neither.
And the right that you do have is the right to negotiate?
A time-limited access to the data. And again, the relationship has to be good. We have to have our eyes open as we're developing these programs. We should be in the pole position for any kind of a negotiation. You can imagine starting, Kathy, how long does it take for a marketing program for a new technology coming out of Stanford? Months and months and months, right? So, but before you actually get customers in the shop, yeah, it's going to be months and months and months. We're in that pole position, so I think that we're good.
Mechanism for valuing the equity?
Mechanism for valuing the equity. So the only equity that there's going to be is in this new bridging enterprise that I was talking about.
For the faculty?
So there are existing rules in each of the academic centers for the share of equity and remuneration from licenses, right?
Yes.
There is a pre-agreed ownership percentage of each of the different partners in Bridge, and all the stock is common. There's no Series A, Series B, no preference rights, none of that. It's all even.
But differential valuation for each project?
There is differential valuation for each project, so that the originating institution that contributes a project gets a disproportionate return compared to the other two institutions. But there is a portfolio play in that everybody gets a little piece of everything.
Understand. Thank you.
Thank you. Thanks very much, Juan.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.